Hi, everybody, and welcome to our free presentation on your birthing options. We're just going to get the PowerPoint started, and then we're going to start our presentation. Okay, so we're going to play from the start. Awesome. Okay, so today we are going to be talking about your birthing options. So, for example, if you've just done a pregnancy test and you found out that oh my goodness, you're pregnant. Yay. How exciting. You might sort of be thinking about, okay, so like what now? So that's kind of where we want to come in and tell you about what now.
Mm-hmm. So I am Sarah Mason, and I am a doula and Lamaze certified childbirth educator with My Confident Birth.
And I'm Madeline Golick, pelvic health physiotherapist with EcoPhysio. So now we're just going to get a little bit more into who we are. So as I mentioned, I'm Madeline Golick. I'm a pelvic health physiotherapist. I'm also a first-time mom of Alice, which you can see in the picture. I started practicing pelvic health in 2014. And since 2016, that's all I practice is pelvic health. And in my free time, I like to travel and do Brazilian Jiu-Jitsu.
I'm Sarah Mason. I am a certified birth doula, a postpartum doula, and a Lamaze certified childbirth educator. I've been working in this field since 2009. I have 4 children, and we like to play board games in our spare time.
Super fun. Any favorite game?
There are quite a few.
Okay, so we'll save that for some other time. Okay, so this is just a quick breakdown of the agenda of the talk. So we're going to just start off with talking about healthcare providers.
Okay, so this is very specific to Ontario. Here in Ontario, we have a choice of different practitioners who are all covered by OHIP for us. So you could have your baby delivered by an obstetrician, a family doctor, or a midwife. It would have to be a family doctor who practices obstetrics, so you can ask your family doctor about that, whether or not that's something that they practice. If it's not something that they practice, then you would be looking for either a referral to an obstetrician, or you would be looking to get in with a local midwifery practice.
Okay. Now, when you say that the family doctor is going to refer to an obstetrician, when does that happen for the ladies?
It really just depends on where you are. So that's really situation specific. I know in a lot of communities now it's happening a lot later. So women are sort of feeling a little bit concerned, but it is pretty typical if everything is going well with your pregnancy now that you don't get transferred to an obstetrician until a little bit later on in that pregnancy.
But we don't know exactly how many weeks. Is it 16? Somebody mentioned it was 16, but I'm not sure.
It can be later.
It can be later.
It can
okay.
be later.
And then with respect to a midwife, when should people be seeking out a midwife?
As soon as possible. So depending on where it is that you live, there could be a wait list for your local midwives. So the best thing to do if you're interested in having a midwife is to call as soon as you find out that you're pregnant and let them know that you would be interested in receiving care from them. Sometimes people get a little bit frustrated because the midwives in their area are already booked. So it can be worthwhile to go on a wait list.
Yes.
Sometimes what ends up happening is people end up having a transfer of care to an obstetrician later on in their pregnancy, and then the midwives are able to take on new clients.
Absolutely. All right, so let's find out a little bit more about what each practitioner will do. So your first option, as we were talking about, is going through doctors. So like an obstetrician is likely the person that's going to be providing you that prenatal care. They're going to oversee your labor in case of complications. So they typically, you will see an obstetrician if you're in a high-risk pregnancy. That's what Sarah was mentioning about that transfer of care from the midwife, is if something becomes more high risk, you will be then transferred to an obstetrician. And of course, you can expect the obstetrician to be delivering your baby.
Yes. So when you are in labor, you're going to labor typically under the supervision of nurses. Okay. So when, nothing serious is going on, everything's going the way that it's supposed to be, you're going to have nurses there who are responsible for your care. And typically you're going to have the obstetrician who's on call at the hospital at the time of your birth, who comes in and delivers your baby and checks on you from time to time.
Awesome.
Okay, so next we're going to talk a little bit about family doctors who practice obstetrics. The nice thing about this option is that you don't have to transfer your care to someone new. So you already have a history with your doctor. If they do practice obstetrics, then you can just stay on with that doctor and you don't need to get to know somebody new. You already have that established relationship and that established trust with them. They may attend the birth a little bit sooner than an obstetrician will. So typically an obstetrician, if everything's going well, is just going to kind of come in right as the baby is being delivered. But a family doctor who practices obstetrics is probably going to attend the birth a little bit sooner than that. And there's also a good chance that your doctor will attend your birth as well. You don't necessarily have to deal with an on-call situation like you would with a practice of obstetricians. So you might be more likely to get your doctor than you would to get your specific obstetrician. Okay, so next we're going to talk about midwives. Midwives are a really great option for people who have low-risk pregnancies. In Ontario here, they attend home or hospital births. So they'll perform, if requested, all of the same tests and clinical checks that you would receive from a doctor. So there's not going to be any kind of missing care because you have a midwife. They're going to do all of the same things that a doctor or an obstetrician would. They are less likely to use interventions that are not medically necessary. And if your situation does change and you aren't low risk anymore, you get transferred to an obstetrician. So I think some of the confusion sometimes, if people aren't really sure how the system works, they think, oh gosh, what if I need a cesarean surgery for the birth of my baby? Well, you're still going to have an obstetrician available to perform that for you, and you would stay with your midwives until it became obvious that something additional was necessary, and then you would get that transfer of care.
Yeah. So when you're picking your provider, just know that other than some special circumstances where you've chosen a midwife and have to have a transfer of care, you can't have an OB and a midwife. So you do need to make a choice about which medical provider is going to best suit your needs and your values. So why don't we get into a little bit about, what they will and won't be doing for you during labor and birth. And so that leads us to expectations. Now we just want to, put a little disclaimer that says these are obviously not absolutes. In most cases, this is what you can sort of expect can or, cannot happen. So, take it with a little grain of salt.
Okay, so obstetricians will provide medical care and monitoring throughout your pregnancy. They're going to make sure that you and your baby are safe. They'll answer all of your questions or concerns, and they work in a team of doctors typically. What they won't do is attend a home birth. So if that's something that you're interested in potentially having, you really need to get in contact with your local midwives. They won't be present throughout your labor. So I always tell clients that I'm working with, if the doctor's not in the room, typically you can be sure that everything is going well.
Yeah.
So when everything's going well, you probably won't see much of the doctor. They are less likely to wait for things to happen naturally. And they may or may not be supportive of birth plans. So sometimes it can be a great idea, if there are specific things that you want on your birth plan, to sort of present it in little chunks of questions to your obstetrician during appointments. Obstetricians will always say, our plan is for a healthy mom and a healthy baby. And I think that goes for all practitioners. Everybody wants that healthy mom and that healthy baby, but sometimes there are a few additional things that moms request or prefer, in addition to healthy mom and healthy baby, as long as everything's going well.
Yeah. Okay, so let's talk a little bit about midwives. So, what you can sort of expect will happen is they will guide and support you through your pregnancy as long as you're low risk, as we've mentioned. They will support your birthing decisions. They're going to be there to encourage you throughout your labor and delivery. They tend to be more comfortable with you going past your due date by 10 to 14 days, as long as there's no risk to the baby. They will visit you at home postpartum and will follow you up until 6 weeks. They also attend births where you've chosen to use an epidural. So that's maybe a more common misconception, is that like if you use a midwife, you can't have an epidural, and that's not necessarily true. A couple things that midwives won't do. So typically, and this is not in every case, but typically they tend to be a little less hands-on. So they're more your verbal coaching, your verbal support. They obviously won't be present in high-risk births. So again, that will be the transfer of care to an obstetrician. They won't do any procedures that are instrumented, so forceps and things like that. They don't do cesareans, and they are less likely to do those medical interventions that we were mentioning, such as an episiotomy.
Right. So anytime you are in labor or during your birth and you require something that is sort of more intervention than what a midwife typically does, that's when they consult with an obstetrician, and that's when the obstetrician comes in and provides care. Sometimes it's just to consult and then the obstetrician leaves, and sometimes a transfer of care is necessary. It just depends on the circumstances.
Yeah.
Okay, so next we're going to talk about the role of a doula. So today, a lot of women are looking for a little bit more individualized care, and then more support during their pregnancy and more support during early and active labor than what is typically offered by medical care practitioners. So that's where I come in. It doesn't matter who your primary care professional is. Hiring a doula is a great option to meet those objectives. We can be the sole provider of support to a woman in labor or who's giving birth, but often women, have a partner that they would really like to be receiving support from as well. So what we can do is really kind of figure out where the two of you are as a couple, if that's the situation, and figure out how we can fit ourselves in to help your partner provide support for you. Or if your partner isn't going to be present, or you don't have a partner, then that's where your doula comes in and can sort of give that hands-on labor support. Each birth is completely unique, so sometimes it can be a little bit challenging to really describe what a doula does, because we accommodate ourselves to every unique situation with clients that we come across. So what we're doing for one birth might be completely different than what we're doing in another birth. We can provide emotional support, support during labor, suggestions for additional education, suggestions for different position changes during labor, all kinds of stuff. We also provide a continuity of care. So while you might have a medical care practitioner that you really, really like during your labor and birth, well, at 7:30, they have to leave and shift changes, and then you get somebody else. The nice thing about having a doula is that you're seeing the same face from the very beginning, when you first call us, to the very end after your baby is born.
That's amazing. And I just wanted to add to what you were saying about, I think in modern times we have different options of who's going to be present at the birth, right? Like, you might have a single mom, or you might have, same-sex couples, or other options. Maybe mom's going to be present because, dad just, your partner might not be able to handle that whole process. And whatever that situation is, having somebody there to support, whoever is there to support you or not there to support you, you get that support. And I think that's great.
That's right. And I think, as much as your partner loves you, if this is your first baby, especially, and you've never given birth before, and your partner has never supported a woman in labor before, sometimes people have really great intentions. And then in the moment, they freeze up and they forget all of the stuff that they learned during their prenatal classes. And sometimes they're really kind of waiting for you as the birthing woman to provide them with guidance, but you're not really usually in the headspace to be telling people or delegating tasks to other people and telling them what it is that you need out of the situation. You're depending on people to give you that.
Yeah.
And if you've never done that kind of support before, it can be really hard.
Yeah. So having somebody there, really great addition. Okay, so what is your role? Tell us a little bit more.
Right. So I assist in preparation for labor, birth, and the postpartum period. I give you emotional support. So a lot of the time things come up that you didn't expect during your pregnancy or during your labor, and I can help work through those unexpected events with you. I talk to you about your birth plan. Sometimes people are looking for help writing a birth plan. Sometimes people have a pretty good idea of what they want in their birth plan. So whether or not you're planning on putting, a written copy into action for the birth, it can be helpful to really just kind of talk to your doula and figure out exactly what it is that you want to see during your labor and your birth. So you get phone and email support during your pregnancy. And then we also do prenatal visits just to get to know your specific needs and preferences, because that's really important.
Of course.
As I mentioned earlier, sometimes it can be hard to describe exactly what we do because it's so individualized. So then a doula goes on call for your birth. So that's really sort of the biggest highlight of having doula support. So when you go into labor, you give your doula a call. And then your doula comes and joins you for that early labor support, maybe before it's time to go to the hospital, if that is what you're doing, if you're doing a hospital birth. And then we join you at the hospital and continue to provide labor support there at the hospital until after your baby is born. So during that labor, we assist you with breathing techniques, labor positions, massage, and all kinds of other comfort measures to help you to be more comfortable during that labor and birth. And we help you to advocate for your needs and preferences. We never speak for our clients, but we help to make sure that your care providers understand what it is you're trying to communicate with them, and that you understand everything that your care provider is trying to communicate to you.
Absolutely, that's great.
So what to expect from a doula? We do home visits during pregnancy and postpartum. We ask you a lot of questions so that we can really understand what your needs are. We give you hands-on support during labor and birth, and we get along really well with your other medical care providers. We give lots of education about what is happening at any given time. So whether that's during your pregnancy and you just have a few questions about common things that pop up, maybe common discomforts that pop up, we can share information about that with you, or we can walk you through exactly what's happening during your labor. We will work in whatever birth setting you have chosen. So if you've decided to do a home birth, that's where we join you. And if you've decided to do a hospital birth, then we accompany you to the hospital as well. We are really fantastic at brainstorming when unexpected situations arise. So a lot of the time what happens is, if circumstances have all of a sudden changed during labor and you're feeling really, really overwhelmed, one of the things that we will do is sit down with you and brainstorm and make sure that if you have any questions, that you get all of those questions answered by your midwife or your doctor. And then we give you suggestions relating to parent craft. And what that is all of the sort of everyday decisions that we make about how to parent our wonderful newborn once we have settled in, after the dust is settled from the labor and the birth. Then you're looking at this little one, and there are all kinds of questions about sleep and feeding. So doulas are really fantastic at providing advice around that.
Yeah, which is great because, until you're holding that baby in your hands, like, you may have ideas, friends, family, things you've read on the internet, but, things are going to be very individual to your circumstance and to your baby and your relationship. And you're going to have questions that like the internet's just not going to be able to answer, because there's just too many options to get to the answer of what is best for you and your family and your baby. And so having somebody be available to answer those questions as they come up is fantastic. All right, so now we're going to talk about the role of a pelvic health physiotherapist. So my role takes on several forms, but before I get to that, I just wanted to mention that a pelvic health physiotherapist is a registered physiotherapist, so we've completed our university training and exams, etc. But to be a pelvic health physiotherapist, you have to undergo additional courses in like the theory, anatomy, and application, assessment, and treatment of pelvic floor dysfunction. And that happens after school, and then we have to be registered with our college. So that would be the College of Physiotherapists of Ontario. So we need to be on there so the public knows that we are, in fact, actually trained to be practicing in this field. So as I mentioned, we have typically two roles during pregnancy, one of which is sort of a response. So you're experiencing pain, or you're experiencing some urinary leakage, or you're having problems with constipation. Those are things that we can respond to and provide you care and treatment and rehabilitation for whatever it is you're experiencing. We also have a proactive role, which is if you're experiencing no problems at all, I offer a labor and delivery preparation appointment. And I'll get a little bit more in detail of what that entails in just a moment. And then whether it's reactive, proactive, it's always a great idea to do a 6-week postpartum assessment. Now, yes, you'll be followed up with your doulas and your midwives and your obstetrician, whichever medical provider or person that's helping you with the pregnancy. They'll be doing their follow-ups. But it's great to see a pelvic floor physio because we can really take the time to assess what's happened after the labor and delivery and get you back to whether it's safe exercise or just regaining bladder control, and we do a lot of different things to help you in a whole life prevention perspective. So as I mentioned, the labor and delivery appointment. So what does that sort of entail? Well, a lot of education, right? Teaching you about how to optimize labor and delivery through exercise, postures, positions. We talk a lot about postpartum prevention measures so that you're able to start these things right after delivery. So you're being proactive. You know what to do, how to protect against an ab separation, how to aid your recovery, things of which, we can't do for that first 6-week period anyway. So other things you might expect with exercises, like we'll go over different breathing techniques. I'm going to teach you how to relax your pelvic floor. So that's reverse Kegels. I mean, most women think about just strengthening, but when you're talking about labor and delivery, you want those muscles to be as relaxed as possible in hopes of reducing the risk of the severity of the trauma that could occur, right? So if you're relaxed and we're teaching you how to relax and connect with those muscles before you go into labor and delivery, that can make a difference. We do go over Kegels because what we found is when we test women, 30% of women will perform a Kegel incorrectly on their first attempt. So, women will say, oh, I'm doing my Kegels, but I'm still leaking. So if we can teach you how to connect to your pelvic floor before the labor and delivery, you're going to know if there's a problem with the muscles or if something's happened to them. You'll know right away because you'll know what it feels like to perform those Kegels correctly. And of course, I can't do a follow-up till 6 weeks. So you're getting like a head start in that 6 weeks to start to regain control of your bladder or your bowel or whatever happens to be your issue. We go over perineal massage, so different ways to stretch out the tissue to prepare you for that labor and delivery. So you start to begin to feel some of the sensations that you might feel during labor and delivery so that you're not afraid. Because
Mhm.
you kind of know, oh, this is a stretch sensation, and oh, this, this doesn't necessarily mean trauma or damage. Because the thing is fear creates tension, and the whole thing is, how can we get you confident and feeling empowered and just being able to relax throughout that whole experience? The other option is we can talk about the Apino, which I'll tell you about in just a moment. And again, posture and protection. The biggest thing, the reason I've started doing this is because I'm treating ladies and they'll say to me, I wish I knew beforehand.
Mhm.
I could have done something sooner. So then I was like, well, how much sooner should we go? And really, that's that during that pregnancy portion.
Well, I think it's really interesting to note that a lot of the first-time moms that I talk to, one of their biggest fears and their biggest concerns is that they're going to have some type of pelvic floor or vaginal trauma from the birth.
Right.
Mhm.
And if we can get you understanding your body better and knowing and practicing how to connect with that area, keep it relaxed, how to breathe
Mhm.
down into the vagina, right? Most women, when I try to describe how to breathe down into the vagina, like it takes 1 or 2 sessions to figure out how to do that. It's just not something that we do,
Mhm.
but it's really, really important to prepare you for that labor and delivery. So I mentioned the Apino as an option. I don't want to discuss it too much in detail. I just want to let you know that I did create a YouTube video about this device. So this is a device for preparing you for labor and delivery. And I made, so if you go to YouTube and you search Eco Physiotherapy, you'll see that we have a channel. And then if you just search Apino demo, it'll provide you more information on how you can use this device. So you can do perineal massage, or you can use this device. And there's different start points of when you can use these devices, which I cover in the video. So make sure to check it out. Okay.
That's great. Okay, so we're going to speak briefly about other practitioners that might be involved in your labor or birth or your pregnancy. Chiropractors. So a lot of women are using chiropractors now during their pregnancy. But I think what a lot of people aren't aware of is that there's something called the Webster technique, and that can be really helpful when breech is a concern with your pregnancy. You do have to find a chiropractor who's specifically trained in the Webster technique, but typically there are local chiropractors who are available to do that for you.
Absolutely. So maybe a naturopath, right? If you're concerned about your diet and how your diet might be affecting the growth of your baby, these practitioners are great. They're going to go over nutrition with you. Not only that, but they'll also talk to you about different supplements, what supplements are good. Like which products to buy. Sometimes buying supplements off the shelf at your local, Fortinos or whatever, place you're buying. Sometimes those supplements aren't tested to make sure that they're actually containing the right part of the plant. Like sometimes they'll use the stems instead of the leaves. And Health Canada will say, well, it is this plant, so therefore, it's a good product, but they might not be using the right part of the plant. And oftentimes, a lot of these supplements aren't being third-party tested for like heavy metals and things like that. So if that's a concern to you, seeing a naturopath to find out what is best for you to take, what's safe for you in your pregnancy to take, that might be the best option. And then they can make prescriptions for you. And they can also help with inducing through acupuncture or acupressure.
Mm-hmm. Prenatal or Lamaze classes. So as I mentioned earlier in the video, I am a Lamaze certified childbirth educator, especially for first-time moms, although second-time moms and third-time moms can benefit from refresher courses sometimes. The information is really fantastic. We talk about all of the different options that are available to you, what you can expect, what is labor like, all kinds of stuff. What is typical newborn behavior, what's normal, and what are things that we need to be concerned about, different feeding methods, all of that type of thing. The nice thing about it is that you can ask your questions to a person, right? Rather than having to Google or rather than having to flip through a book, and that information might not be specific to you. The nice thing is that you have that childbirth educator who's there to help you with your specific concerns, and you get to meet people who are also expecting from your neighborhood. So that's really nice as well.
Yeah, but Sarah, people can get prenatal classes for free. So what makes your classes different from some of these free classes that are out there?
So a lot of the time, people will go to their sort of public health classes to take those classes. And it's really fantastic that those classes exist, but there is a fairly significant difference in the curriculum. So when you attend a public health class, it's very basic, generalized information that's good for everybody, because they have to make one curriculum that suits all of the people who are going to be at their class. The nice thing about Lamaze classes is that it's a smaller group. So all of the information that you get is really more personalized to what you might be going through or what you might be experiencing, what your specific fears are and your specific concerns are. There's also a lot more room for conversation and give and take, rather than you sort of sitting there and listening to a lecture. It's a lot more interactive. There are different games that we play, different activities that we do, different demonstrations that happen. It's a lot more interactive, and it suits a lot of different learning styles, as opposed to just sort of sitting and receiving information that they feel like everybody needs to hear.
Right. And so you can then tailor a little bit. I mean, you have your curriculum, but you can sort of tailor it depending on the needs of the people that are signed up. And of course, because it's interactive, they can ask questions.
That's right.
Right. So if you're thinking about, attending Lamaze classes, you want to see her. Okay. So this is the part where we're going to talk about how you can contact us. Okay. So we're going to give you some contact informations. But before we do, we have a couple questions for you. So these are yes or no questions, and feel free just to answer them in your own head. But the first question is, did you have a little bit of fun with us today? Hopefully the answer to that is yes. Did you find our information informative? I mean, we certainly hope that you did.
Can you see yourself starting to weigh in on what options you might like for your pregnancy and your birth? And did you see the benefits to each practitioner when it comes to your own labor and birth experience? Because everybody's different, so everybody's going to be looking for something slightly different out of their labor and birth experience.
Awesome. So if you're answering yes to these questions, then you definitely want to get in contact with us to, try to get more value out of us. So amazing. Okay, so this is my contact information. So you can gather more information about what I do in pregnancy and postpartum at our ecophysio.com website. Of course, we're on Facebook. So if you just type in ecophysiotherapy, you'll see that we pop up. We're on Instagram, we're on Twitter. As I mentioned, we have a YouTube channel. So if you just type in ecophysiotherapy, you'll see. So we have a pregnancy series of videos where, short 5-minute information segments, different exercises that you might be looking into. So definitely search us out. Our work phone number. So if you want to call and ask me some more questions that might be specific to you, our contact detail is there, or you can always email us info@ecophysio.com.
And to get in touch with me, you can visit my website at myconfidentbirth.ca. And we also have a Facebook page that gets updated regularly, or you can email us.
Awesome. So thanks everybody for watching our video. Stay tuned as we hope to, release other information sessions in the future, and contact us with your questions. We don't want you wondering if something was unclear in the presentation and you just want to have it clarified. Send us a message. We'll be more than happy to respond to you as soon as we can.
Thanks.
Anyways, bye for now. All right. So